This presentation aims to investigate the functions and effects of transcranial direct current stimulation, or TDCS, on the brain and physiological mechanisms of depression. By doing so, this presentation discusses the link between the two and how TDCS can help mitigate depression by understanding the physiological mechanisms. Transcranial direct current stimulation is a low-current, non-invasive therapeutic technique that is used for stimulating the cortical areas of the brain by conducting a direct electrical current through two different electrodes. The anode is the electrode where positive current enters the body, while the cathode has positive current exiting the body. The two electrodes create an electromotive force that pushes positively charged ions away from the anode and pulls those positive ions towards the cathode. The aim of the electrodes is to alter the resting potential of the membrane. However, TDCS does not cause a change in potential, as the intensity of the current is 0.5 MV, while the membrane resting potential is negative 70 MV. The direct flow from anode stimulation causes the resting potential to become more positive, as it inhibits neurotransmission through GABA, whereas cathode stimulation causes hyperpolarization by inhibiting glutamate. TDCS has also been found to alter acetylcholine, serotonin, and dopamine systems. As TDCS can stimulate different regions of the brain, the placement of the anode and cathode can either enhance or reduce the activity of the chosen brain regions. The effects of TDCS depend on a variety of factors, such as the active area under stimulation, its regions of projection, the adjacent structure at resting state, the pathological changes in neurotransmitter systems, and the medications taken by the patient. There are a range of physiological mechanisms that have been found to have a relationship to depression, such as altered brain structures, neurotransmitter imbalances, and the neurotrophin hypothesis. The dorsolateral and ventromedial areas of the prefrontal cortex, as well as the hyperactivity from the limbic system, which contains the amygdala, hippocampus, and thalamus, have a direct role in explaining the physiological mechanisms of depression. The prefrontal cortex produces inhibitory effects on the limbic system, which means when the prefrontal cortex suffers from a decrease in activity, the neurocircuit balance within the limbic system is disturbed, causing dysregulation in neurotransmitter activity and neuroendocrine functions. Depression has been hypothesized to be associated with the decreased expression of several neurotrophins, such as the brain-derived neurotrophic factor, or BDNF, which is responsible for neuron survival and synaptic signaling, and is associated with the increase in synaptic strength. Low BDNF and DPFC activity has been found in suicide victims with major depressive disorders. Those with depression have found that brain regions such as the amygdala decrease in volume, which is associated with BDNF. Neurotransmitter systems, such as serotonergic and norepinephrine systems, have been associated with depression. Serotonin travels through many brain regions, such as the amygdala and hypothalamus, meaning low serotonin levels causes an imbalance in those brain regions, which has been found to be associated with depression. This proposes the question of whether the effects of TDCS can mitigate depression through physiological measures. Some studies focus on the theory that placing the anode stimulation on the left dorsolateral prefrontal cortex and the cathode, while the cathode is normally placed on the DLPFC. By doing this, TDCS hopes to increase the DLPFC activity and restore its normal functioning. However, clinical effects are still unclear. TDCS can affect neurotrophins such as BDNF, which helps with neuroplasticity, and as depression has been found to reduce brain volume in areas such as the amygdala, TDCS can then restore the brain volume, therefore resulting in antidepressant effects. Lastly, by using TDCS to improve the rate at which the serotonergic system produces serotonin, it may lead to antidepressant effects. This presentation explains the effects of transcranial direct current stimulation in the human brain, such as how the two different electrodes influence brain activity. The physiological mechanisms of depression is then discussed, and was found that depression can alter brain structures, cause neurotransmitter imbalances, and decrease brain volume. By using the effects of TDCS and mechanisms of depression, this presentation discusses how they can be integrated to mitigate depression by using different theories from literature. Future studies should focus on identifying the individual differences between participants, such as the severity of depression, and how that affects the results of TDCS. Another potential way researchers can investigate is using a mix of intervention strategies to reduce depression. An example of this would be using TDCS and SSRIs.